Focus on Health, your weekly dose of health and wealth information on KUTV.
Welcome to Focus on Health, where we demystify matters health. My name is Bwari Michelle. Cancer is the second leading cause of death in the world. However, the survival chances have increased due to the improvements on screening. So maybe we could start by defining what cancer is.
Yeah, so thank you, Michelle. It's really nice to be part of the program and to create awareness on cancer, which is really a rising cause of disease and death in the Kenyan population and globally. Yeah, so cancer by definition is cells that change or undergo mutations or changes that make them not have the multiply uncontrollably. So a normal cell will usually have a lifespan. So after being and after cell division of whatever organ the cell is, then has a lifespan, and after that is cleared off or dies. But then what you find cancer cells are actually cells that behave abnormally. So they're your normal cells, but then either due to some genetic changes within the cell itself that make it not have this lifespan. So then it either multiplies itself more than expected or does not die within the expected time. So what happens is that now you end up with a growth. And commonly, actually, if you go to the lay people on the street, they call cancer a growth. Or you hear somebody has a growth. So these are cells that are multiplying faster and staying longer than expected. So you end up with a swelling. And generally, that's what we call cancer.
Okay,
yes.
That's actually quite educative, Dr. Dr. What types of cancers do we have? Yeah,
so cancers can happen. There are as many cancers as there are cell types in the body, because a cancer can happen in any part of the body. But commonly, we have breast cancer, cervical cancer, among women particularly. For men, we think about prostate cancer, affecting the prostate gland. We can also have cancer in the esophagus, which is also common. So a cancer of the esophagus, and then we also have cancer of the large intestine, or what we call the colorectal kind of cancer. So those are the most common. However, you might have even cancer of blood cells. And now, depending on the type of blood cells, you can have leukemia, lymphoma, and such kind of things.
Okay.
Yeah.
So, Doctor, maybe to clarify, you said you can maybe get cancer you can contract cancer based on any cell.
Any cell can become cancerous. So it's not really contracting. Any cell line can become cancerous. In the sense that now it doesn't undergo the normal process. It multiplies and does not die at the expected time.
Yes. And actually, what exactly now causes cancer?
Yeah, so the causes of cancer are many. Of course, we think of things like smoking or environmental pollution. These are factors that may lead to cancers of the respiratory system. Like, for example, you know that for smokers, we actually warn them of higher risk of lung cancer or even pharyngeal cancer. The environment matters, and things like smoking. So that can cause cancers. And what it does, it actually causes changes in the genetic makeup of the cell that makes it now multiply abnormally. So you can also have radiation, for example, like the sun, excessive sun exposure, and you have cancers of the skin. So radiation can actually cause, and you can even have radiation, artificial radiation, for example, like in a nuclear war or in a nuclear bomb. You find actually the nuclear radiation can actually cause cell changes. Diets also have a role, and particularly the processed foods. So you have like things like sausages, ham, and the processed meats. And actually those have been shown to cause gastrointestinal cancer. So you are talking about colorectal cancer, particularly associated with processed foods. The other cause of cancer can be viruses. For example, like we have the human papilloma virus or HPV virus that is associated with cervical cancer. We have the H. pylori, the bacteria that's associated with stomach cancer. So infections can also predispose. They actually might not cause, but then they'll predispose. Yeah.
So actually, now we've talked about various types of cancers. Maybe you could narrow down to the ones that are more common to women, that is breast cancer and cervical cancer. Why is it that they are more common to women?
Well, they are more common to women because, for example, like breast, women have more breast tissue. So that means more cells that can actually turn cancerous. Cervical is also because women are the ones who have cervixes. So now at least men in that respect be it exempted, so to speak. But the amount of cells and even the hormonal changes that happen through the woman's cycle, because you see the hormonal makeup of women and men is different. So that also predisposes them to different types of cancer, as we say.
Doctor, maybe now if you take us through the various signs and symptoms that we have for cancer.
Yeah, so thank you, Michelle. The signs and symptoms will depend on the particular type of cancer. So depending, but generally we could say you'll have changes in the size of the particular organ. For example, if it's breast cancer, then you'll have a swelling in the breast. Yes. Then even the texture of the skin will also change. You may have like bleeding, for example. So really in cervical cancers, but really the symptoms are dependent on the particular cancer that you're dealing with. Yes. So I think maybe we could talk about breast cancer, and you'll have that you have a mass or this firm nodule in the breast or mass, and this might also be associated with node swelling, or what we call the axillary node swelling, that may also be a sign that something is going wrong. Yes. For skin cancer, you can actually have a change, discoloration of a particular skin area, and this discoloration actually changes, is growing or expanding in sizes. Usually you'll also have irregular margins, and then there might be pain, because you can imagine these cells are multiplying faster than usual, so there is pain. There is also what we call pressure symptoms. So when this mass is growing, it also exerts pressure on the surrounding tissues. So you might have blood vessels that are pressed, nerves that are pressed, and that causes pain. Yeah. So the particular location of a particular cancer gives you cancer-specific